Bell Let's Talk Day is today, and this year's theme is taking a moment for our mental health. So here to talk about the importance of our children and teens' mental health, we welcome back Dr. Alexa Bagnell, the Chief Psychiatrist of the IWK. Thank you so much for being here.
Thanks for having me.
I mean, it's always a pleasure to have you here and welcoming us and giving us some great advice. So when it comes to youth or family with the IWK health and mental health support, what is the journey looking like for most?
Yeah, a lot of people don't know what the journey looks like, and we've made it really, really easy in our province. So there's one number to call. I actually remember it too, so it's pretty easy to remember. So it's 1-855-922-1122. And that gets you in the province to an access navigator. And they help figure out what's the best match for you in service. So it's a really cool one-stop so that youth can call, it's a self-referral, families can call, and even providers. So it's a really good way to make sure that help is really accessible.
And all-encompassing.
All-encompassing. It's actually all age groups, but we have a youth-specific. Once you find out you're a youth, we match you to a youth service.
Amazing. And then can you walk us through the range of supports that may be available depending on their needs?
Yeah, so across the province, we have community clinics, mental health clinics that give supports to youth and families across our province, and we have those in Halifax as well that are under the IWK. We have emergency services if that's needed in a crisis. We have inpatient services. Some youth do need to come into hospital for care. We have intensive services, even coming into your home and helping support families. And we have new services that are called Anchor Youth Space across our province, led by our community organizations. And they are low barrier access. You can walk in as a youth from 12 to 25 years of age. So it's a really broad range. Right now we have 3 open in our province. We have one in Amherst, one in Sydney, and one in North End Halifax. Okay. So amazing range of services.
Absolutely. And so you talked about the phone number. How does the process start other than making that initial call?
Yeah, when you make the initial call, say you're a youth, you'll meet with a person on the phone, and you can even book that actually a time to talk to them online. And I should mention we have evening hours and weekend hours too. And that person asks some questions, and it's really about what's going on in their life, how is the mental health problem interfering, and what are they looking for help. And then they get matched to a person to talk to.
Amazing. So all-encompassing in that sense. In 2025, we saw the launch of the first 3 of those sites. What has the response been?
Amazing. Yeah, our community organizations that are leading our Anchor Youth Space sites are really inspiring. And the spaces that have been created with youth and caregivers, you walk into those spaces, they're totally different. You can tell youth have been a big part of it, and they're really welcoming. There's all sorts of services under one roof that the community organizations have put together. And so to name them would be very hard, but they're all youth-specific. And we've really seen a huge uptake. We actually monitor how many youth are using the services, and it's been like this.
Oh, wow.
It's fantastic. So we're really excited about them, and we have 5 more opening, 3 more this year.
Amazing. Such great work.
Yeah.
For Bell Let's Talk Day, there's a focus on breaking down the stigma from your perspective. What's the thing you want families to know about seeking support?
I think the one thing I'd like people to know, it really fits with Bell Let's Talk Day, take a moment, is how important it is to look after your mental health. And that mental health and physical health, they're intertwined. So really looking after your mental health, thinking about it, and reaching out for help. Help really works. And we have a lot of great help in our province. We're really fortunate. So to please reach out.
Amazing. Well, thank you so much for all you do and for taking the time to chat with us today about that.
Thanks so much for having me.